This video will provide an overview of the macros built into SAA. The most important thing to do at the start of a case is to initiate a macro. This will select the parameters the record will draw in from the connected devices and populate a to-do list with frequently used actions and medications that we can work through during the case. There are several categories of macros. The general category includes an ETT and LMA general anesthesia cases. There is a major invasive macro, which includes arterial line and central venous catheter placement. There are pediatric macros, one for rigid bronchoscopy and one for thoracics, where we will be documenting a double lumen tube. There are a number of sedation macros. For high turnover lists, it's useful to have some more specific macros that pre-populate documentation, such as position. If the case involves simple sedation, or if the primary anesthetic will be regional anesthesia, use a sedation or monitoring macro to ensure the monitors are recording data. Regional block macros will facilitate the documentation of the block, in addition to some commonly used medications associated with regional anesthesia. Procedures will populate the documentation of the action and turn on the appropriate monitoring. When documenting a medication in SA anesthesia or in PowerChart, you're actually documenting a particular product. 0.5% ropivacaine is not a formulary product. In practice, we dilute 1% with an equal volume of saline to create 0.5%. These macros just auto-populate those dilutions to make documentation more straightforward. In SAA, the TCI medications can't be documented in the medication section as we are documenting a target concentration, not a dose. So these macros will turn on a TCI label in the monitor section, in which target concentration can be documented, in addition to documenting the TCI model and the total propofol dose where appropriate. Subspecialty macros include cardiac and liver transplant surgery, and macros for the very rare instance of obstetric cases. There are some particular monitoring macros as well to facilitate different modes of the hemisphere, different modes of neuromuscular monitoring, and depth of anesthesia monitoring. Cerebral oximetry and ICP monitoring also have individual macros. That's all the macros in the current SAA build. Be sure to explore them before the go live.